What are less common things that we should tell our patients prior to surgery that they should know about?
So, obviously we always do a very extensive history and physical. I want to know about medications, other medications that they're taking. So certain medications like steroids or immunosuppressants can affect wound healing, and we want to know about that. There are certain times where we can stop these medications, and sometimes we can't. And as long as we have a discussion with the patient and they know the risks involved, then we proceed otherwise.
What would you tell patients that are trying to get pregnant or are currently pregnant about elective procedures?
Yeah, great question, and it seems like a weird question to ask, but at the same time, we ask it because with procedures involving breast shaping, so whether it's breast augmentation, breast reduction, breast reconstruction, that all affects the future of lactation. And or the shape of the breasts as women go through pregnancy. Same thing with abdominal-based procedures like abdominoplasty, tummy tuck, abdominal wall reconstruction. Anything that involves the sort of torso area can be affected and stretched by future pregnancy. So that's an important question that we like to plan with them so that they have the result that they desire.
And then what about patients that say they're going away or traveling in the near future?
Yeah, and this is a question that I kind of learned to ask more and more as we go along. And so, I want my patients, especially for general procedures, for big procedures, to be at least available for the following 2 to 3 weeks after surgery, just because we want to follow up with them. We want to make sure that everything's going well, that if there's anything going on that they need help with, that we catch it early on and help them with it. Obviously, this is not a one-size-fits-all rule. So if someone is coming from a different state, we'll make the appropriate accommodations. And we have sister practices and also physicians that we work with around the country that can help us in certain circumstances for out-of-state patients.
Specifically about flying, what are you worried about?
Yeah, good question. So if people are going to be on a plane for several hours, the risk of DVT or forming a clot in your leg is going to be higher. So if you're not on a blood thinner after the surgery and you are using walking and hydration and all to prevent blood clots, I'm going to want you to get up several times during the longer flight and make sure that you're active and maybe wearing compression stockings at the time to prevent that risk. And same thing goes for long car rides.